7 common myths about fatty liver, said Dr. Adarsh CK, Gleanagles, BGS Hospital. 1. Fatty liver is common. No need to worry. Yes, fatty liver is very common but not normal. Up to 30% of Indians have fatty liver. However, 20% of them can progress from plain fatty liver to a condition called steatohepatitis to fibrosis to irreversible condition called cirrhosis. Since there are crores of people in India with fatty liver, lakhs of them can end up with liver cirrhosis. 2. Only alcoholics develop fatty liver. Alcohol is one of the common causes of fatty liver, not the only cause of it. 3. There are no tests once fatty liver is diagnosed. Once fatty liver is diagnosed on ultrasound scan, a battery of blood tests will be done, including liver function test. 4. Whiskey is bad, however beer is no big deal. No. Alcohol in any amount or content can be dangerous. Refrain from alcohol to prevent liver damage. 5. Fatty liver is irreversible. No. Fatty liver is definitely reversible if detected at right stage. Regular physical activity, exercise, weight reduction, healthy diet avoiding junk or processed food, having enough fruits and vegetables, avid smoking alcohol, control of comorbidities like control of diabetes, hypertension, cholesterol and others. 6. Fatty liver is not preventable. No. It's definitely preventable with above mentioned lifestyle modifications and control of comorbidities. 7. There is no cure for fatty liver. No. Fatty liver is definitely reversible depending on the stage. Once patient develops liver cirrhosis, liver transplant may be the only curative option. So please get treated at right time.
Yeah, hi, I am Dr. Adarsh CK, Chief Consultant Gastroenterologist and Hepatologist, Gleanagles BGS Hospital, Bangalore. So today actually is June 12th. It's celebrated as World Fatty Liver Day. So this is to increase the awareness and information to the general public. So why is this fatty liver important? See, most of the time patients always tell to me, "Sir, fatty liver is so common. Many of us have. What is so special about it?" Yes, what I would say is fatty liver is common, but that is not normal. As I told, it's quite common. In India, approximately 30% of us have fatty liver. So one in three of you may be having fatty liver. So the significance is because India has such a huge amount of population, there are crores of people with fatty liver. So, and what happens with fatty liver? So, if there are 100 people with fatty liver, 20% of them may progress over a period of time to develop liver cirrhosis over many years. It doesn't happen overnight, it takes many months to many years. But then, since there are crores of people suffering from fatty liver, there could be lakhs of people who may end up with liver cirrhosis. And once there is liver cirrhosis, this becomes irreversible. So next thing many of them ask is, sir, I don't consume alcohol, I have fatty liver. Why is that? My friend who consumes alcohol, he doesn't have fatty liver. See, fatty liver is mainly a lifestyle related disease. We could broadly classify fatty liver into alcohol related and non-alcohol related. Among people who take alcohol, it's called alcoholic fatty liver. Who don't take, it's called non-alcoholic. Now it's a new terminology called MASLD or metabolic dysfunction associated steatotic liver disease. This is a new terminology for fatty liver. So, who are at risk of developing fatty liver apart from alcohol? Patients who have diabetes, hypertension, high cholesterol, thyroid issues, overweight, obesity, and very bad lifestyle. So basically, it's a lifestyle related disease. That is the main thing. See, malaria, dengue, it happens due to viruses and other things. It's an infection. Whereas fatty liver is a lifestyle related disease. It is a lifestyle to be blamed for. Everything relates to westernization. See, previously people used to go or walk or cycle from one place to another. Now everybody uses two wheeler or four wheeler. And if another astonishing thing is even among children, almost 25 to 30% of even children have fatty liver. So this is really astonishing and surprising because nowadays even children they don't go to playground to play. Everything is mobile, iPad, iPhone, all those things. So nobody wants to go on field. So because of lifestyle and eating habits, everybody now has a lot of processed food, junk food, sweets, sugars, aerated drinks, all these film stars, they also advertise so many health drinks, aerated drinks, and none of them are scientifically based. Please avoid them. And then again, lack of physical activity, exercise. So these are the common risk factors, and sometimes even without any of these risk factors, they can develop, which we call it as lean fatty liver. Patient is lean, but they still have fatty liver. That's because sometimes due to genetic influences as well. So again, next question people ask is, sir, if I don't have symptoms, why should I be bothered? Yes, now fatty liver is called silent killer because it doesn't cause any symptoms to begin with. Once fatty liver goes to the stage of liver cirrhosis, that is when the symptoms appear. So fatty liver, there are stages: plain fatty liver with hepatitis, or fatty liver with fibrosis, and liver cirrhosis. So first three stages are reversible, and last stage is not reversible. So again, people ask, okay, sir, I have fatty liver. What should I do? So I always suggest, whoever has fatty liver, please consult your gastroenterologist. Most of the time, yes, it may not cause any issues, but in 20% of them, it can progress. We don't want even in 1% of them for it to progress. So once we usually get a liver function test, and we usually get tests to see if there are any risk factors like cholesterol, sugar, thyroid, BP, and other things. And now we have a test called fibroscan, which will tell how much fat is there, how much fibrosis is there. It will give the information as good as what liver biopsy means. If you put in a needle into the liver and see the tissue and analyze, almost 95% of the same information can be given by fibroscan. So depending on all these things, we can treat. Again, next question people ask is, okay, I've done everything. Anyway, there is no treatment. Why should I be worried? Yes, there is no specific treatment as such, but it's a lifestyle related disease. So the main treatment is lifestyle. Eat healthy, eat whole food, whole grains. If you have one plate of food, 50% of it should be vegetables and others should be cereals or other things. Oh, unfortunately, now most of them, they have hardly 10% of their portion as vegetables and fruits. And then physical activity, at least 45 minutes of brisk walk. We don't want everybody to go to gym and spend money and everything. Just 45 minutes of brisk walk 5 days a week is good enough. They need not do any heavy weights or anything. And then healthy lifestyle, sleep at the right time, get up at the right time, decrease your screen time. All those things are over a period of time going to help. And in spite of your lifestyle modification, if the symptoms are persistent, that is when we look at pharmacotherapy or medications. There are again various medications available in the market, starting from vitamin E to recently launched new product, which is launched in India. And even though it's very expensive, that is very efficacious. But as I told, more than medicines, it's the lifestyle which is the most important. Again, coming to the prevention, we all know prevention is better than cure. The same healthy lifestyle is going to prevent as well as treat fatty liver. So this is the main thing. To summarize, yes, fatty liver is very common. It is not normal. It doesn't cause symptoms unless it goes to the stage of liver cirrhosis. So don't wait for the symptoms. Please get yourself checked for fatty liver. If so, meet your gastroenterologist and get appropriate investigation done. And to prevent and treat fatty liver, the mainstay is lifestyle. Eat healthy, stay healthy. Regular exercise is the key. Apart from that, avoid smoking, alcohol. And if you have any risk factors like diabetes, hypertension, cholesterol, thyroid, please get it under control. If you are overweight, come to the right weight. Thank you.
Hi, I'm Dr. Bhuvan Shetty, consultant gastroenterologist and hepatologist, Gleanagles BGS Hospital, Kengeri, Bangalore. So today is World Fatty Liver Day. So we just discuss about what exactly is fatty liver. So fatty liver is a very common condition. We usually see it in close to 30% of the population. So the 1 in 3 people around us might have fatty liver. So when I talk about fatty liver, it basically means that there's an excessive accumulation of fat in the liver. So there are multiple causes for it. So usually people think that liver disease or fatty liver usually comes because of alcohol. So alcohol is one of the causes, but there are a lot of other causes which can cause fatty liver. So some of the most common causes is one is obesity, diabetes, long-standing uncontrolled diabetes can cause fatty liver, increased cholesterol can cause fatty liver, hypertriglyceridemia, thyroid condition can cause fatty liver. Even excessive sudden weight loss can cause fatty liver in some people. The fatty liver is divided into four stages. So there's only fatty liver. Then people present with fatty liver with hepatitis, where there will be a slight changes in the blood reports for the liver. There is fibrosis, and last stage is cirrhosis. So the first three stages of the fatty liver is treatable and reversible. But once it reaches the stage of cirrhosis, it's irreversible, and most of the times patients end up with transplant. Uh, there are no particular symptoms for fatty liver. So usually patients might just come with a vague discomfort, generalized weakness. So usually it's that's the reason it is called as a silent killer. Patient will be absolutely fine. They just go get some routine blood test or investigation done and might get to know that they are suffering from fatty liver or its related complication. So when the patient comes to us with either if they're suspecting fatty liver or there are some changes, so the routine we get some routine investigations done for the patients to see the liver function tests, so how the liver is functioning, the cholesterol levels, the diabetes and hypertension if it's under control. Ultrasound imaging helps us to diagnose, gives us a vague idea about the stages of the fatty liver. There are newer non-invasive tests like fibroscan, which gives us a very particular what stage of fibrosis or fatty liver the liver is in at that time. The treatment for fatty liver mainly includes lifestyle modification. So, as I told you initially, the main one of the causes are increased processed food, alcohol, fried items can cause uh, uh, increase the risk of fatty liver. So, regular exercise, weight loss of close to 5 to 10% of the total body fat index helps to reduce the risk of fatty liver. Reduction of processed food, aerated drinks, alcohol helps to reduce the risk and helps those lifestyle modification is one of the first step to be taken in the treatment of fatty liver. Then there are some newer medication. There are some medications which we can give which helps to reduce the fibrosis content. Recently, in the last 2 months, there have been some new developments in the new treat. Sorry. In the last 2 months, there have been some new treatment options which are available, which helps to lose weight and helps to get the fatty liver under control. So, better to meet a gastroenterologist for further treatment for this. Fatty liver is a very common disease involving close to 30% of the general population. Most of the times, the patients have no symptoms at all. That's the reason it's called as a silent killer. Uh, and the best treatment option which is available is lifestyle modification, regular exercise, weight loss, eating a good balanced diet, and avoiding of the processed food is one of the main things. If even after that the fatty liver is persisting, there are other modification medications available for that. So at the end of the day, take care of your health, take care of your liver, eat good food, and have a nice day.